Many people with chronic lung diseases, such as COPD or asthma, use a nebulizer to take their medication, in the form of a mist that is inhaled into the lungs. Nebulizers are often recommended for patients who have a hard time using inhalers because of health issues, or patients who are unable to inhale deeply enough for other devices. Hi, I'm Yura and I'm going to demonstrate on how to use a nebulizer. So a nebulizer has 5 basic parts: a medicine cup, a top piece cup attached to a mask, a thin plastic tube connects to a machine, and an air machine called a compressor, which can be plugged in into electrical shock for indoor use. Step 1. With clean hands, take the medicine as prescribed by your healthcare provider. Check the label of the expiry date, then pour it into the medicine cup. Step 2. Attach the top piece into the medicine cup and then the mask. Step 3. Connect the tubing from the compressor to the medicine cup. Step 4. Get ready to administer your medicine and put the mask over your face. Adjust if needed. Step 5. Turn on compressor. Step 6. Take normal regular breath in through your mouth so that the medicine can go deep into your lungs and continue until all the medicine is gone from the cup. And that's all. Thank you.
Dermal patch is a medicated adhesive patch that is placed on the skin to deliver a specific dose of medication through the skin and into the bloodstream. Often, this promotes healing to an injured area of the body.
Hello everyone, my name is Jared and today I am going to show you how to administer a transdermal patch. Let's go.
So first step, before using the patch, read first the instructions on how to properly apply the patch. Usually, this is seen at the back of the packaging. Read it carefully and try to follow it as much as possible. Next step is to take out the patch and remember to take it out carefully to avoid damaging the patch. Check if the patch is damaged, and if the patch is damaged, do not use it. Next is to select an area where you can apply the patch that is clean, dry, and free from excessive hair. When you are ready to administer the patch, hold the non-sticky part and gently pull half of it and place it on the application site. Lastly, pull the other half gently. And when you have successfully pulled the other half, press firmly using your hand and make sure that the patch is well adhered to the skin.
So that is how you administer a transdermal patch. I hope you've learned something and I'll see you next time.
Ear medication is frequently prescribed to soften and loosen the ceramen or the wax in the ear canal for anesthetic effect, to immobilize insects in the ear canal, and to treat infections such as fungal infections. For today's video, I will be demonstrating to you the proper way of administering an ear drop. The first thing that you're gonna do is you're gonna instruct the patient to lie or to sit upright with their head tilted towards the unaffected side. So you're gonna make your patient lie down like that towards the unaffected side. The next thing that you're gonna do is you're gonna straighten the external ear canal. So for the adults, you're gonna have to pull the auricle of the ear from up and back. And for the children up to the age of 3, you're gonna have to pull the auricle of the ear from down and back. So for the adults, it's up and back. And for the children, it's down and back. The next thing that you're gonna do is you're gonna have to instill the prescribed number of drops and make sure to avoid containing the dropper. So for example, this is the ear drop and you're gonna have to instill 2 to 3 drops. So for example, 1, 2, 3 drops, and that's it. For the last step, you're gonna instruct the patient to remain in his position for 2 to 5 minutes to prevent the leaking of the medication out of his ear.